Do you know what your blood pressure numbers mean? That's a question that resonates with all of us, whether we're fitness fanatics or just trying to stay on top of our health. So, let's talk about blood pressure. Blood pressure is essentially a measure of the force with which your heart pumps blood around your body. It's recorded in millimeters of mercury, or mmHg for short, and it's represented by two numbers. The first one, the higher number, is your systolic blood pressure. This measures the force your heart exerts on the walls of your arteries each time it beats. Think of it as the pressure created when your heart springs into action, sending a fresh surge of blood out into your body. The second number, the lower one, is the diastolic blood pressure. This measures the force your heart exerts on the artery walls in between beats when the heart is resting. It's the pressure that remains in your arteries when your heart is in its relaxed state, refilling with blood for the next beat. Now, these numbers don't just exist in isolation. They fall into several categories that help us understand the state of our cardiovascular health. There's normal, elevated, hypertension stage 1, hypertension stage 2, and hypertensive crisis. Each category indicates a different level of pressure in the arteries and has different implications for your health. The key is to regularly monitor your blood pressure. High blood pressure, or hypertension, often doesn't present with obvious symptoms, but it can lead to serious health issues like heart disease, stroke, and kidney damage. Understanding your blood pressure numbers can be a key indicator of your heart health. So, the next time you check your blood pressure, remember the significance of those two numbers. Stay tuned as we delve deeper into understanding blood pressure readings in the next segment. Have you ever wondered what the two numbers in your blood pressure reading mean? Well, let's unravel this mystery together. When we talk about blood pressure, we're referring to the force your heart uses to pump blood around your body. This force is measured in millimeters of mercury, or mmHg, and is expressed by two numbers. These numbers are your systolic and diastolic blood pressure readings. The higher number, your systolic blood pressure, measures the force your heart exerts on the walls of your arteries each time it beats. Think of it as the pressure created when your heart contracts and pushes blood out into your body. The lower number, your diastolic blood pressure, measures the force your heart exerts on the walls of your arteries in between beats. This is the pressure in your arteries when your heart is at rest, filling up with blood for the next beat. Both these numbers are crucial in understanding your overall blood pressure. Here's why. The systolic reading indicates how much pressure your blood is exerting against your artery walls while the heart is beating. On the other hand, the diastolic reading indicates the pressure in your arteries when the heart is resting between beats. These readings are not just numbers, they are indicators of the health of your cardiovascular system. A high systolic reading could indicate that your heart is working too hard to pump blood, which can eventually lead to damage to your heart. Similarly, a high diastolic reading could suggest your arteries are not relaxing properly between heartbeats, which can also lead to cardiovascular issues. So, understanding these two numbers helps you grasp the state of your cardiovascular health. It's not just about good or bad blood pressure, it's about understanding how well your heart and arteries are functioning. So next time you check your blood pressure, remember the importance of both these numbers. They are your personal insight into the working condition of your heart and arteries. And that's a valuable piece of information to have at your fingertips, or should we say, at your heartbeats. Did you know that blood pressure readings fall into different categories? Each category provides crucial information about the state of your cardiovascular health. Let's dive right in. First up, we have normal blood pressure. This is when your systolic blood pressure measures less than 120 millimeters of mercury and your diastolic blood pressure is less than 80 millimeters of mercury. Think of it as the ideal state for your heart, pumping blood just right, not too hard, not too soft. Next, we have elevated blood pressure. This is when your systolic number falls between 120 and 129 millimeters of mercury, while your diastolic number remains less than 80. It's like your heart is beginning to pump a bit harder than it should, a potential early warning sign. Let's get into the hypertension stages. Hypertension stage 1 is when your systolic number is between 130 and 139 millimeters of mercury, or your diastolic number is between 80 and 89. It's like your heart is pumping with too much force, which can start to strain your cardiovascular system. Hypertension. Stage 2 is when your systolic number is 140 or higher, or your diastolic number is 90 or higher. This is like your heart is working overtime, pumping hard and potentially causing damage to your blood vessels and organs. Finally, we have hypertensive crisis. This is when your systolic number skyrockets above 180, or your diastolic number shoots over 120. This is a critical situation, like a ticking time bomb. It requires immediate medical attention, as it can cause severe damage to your vital organs like the brain, heart, lungs, and kidneys. These categories aren't just random numbers, they are vital indicators of your cardiovascular health. They help healthcare providers determine the most appropriate treatment to maintain or achieve healthy blood pressure levels and reduce the risk of cardiovascular disease. Understanding these categories is crucial, as high blood pressure often does not display any obvious symptoms, but can lead to serious health issues, including heart disease, stroke, and kidney damage. Knowing these categories can help you understand where your blood pressure stands. Are you aware of the signs and symptoms of hypertension? Hypertension, also known as high blood pressure, often sneaks up on people with subtle symptoms that can be easily overlooked. However, being aware of these early warning signs can help you take proactive steps toward managing the condition and preventing serious health complications. A common sign of hypertension is a persistent headache, often described as a dull ache. This discomfort is due to the excessive pressure exerted on the walls of the arteries in the brain. It's important to note that not everyone with hypertension experiences headaches, but if you do have them frequently, it's worth discussing with your healthcare provider. Blurred vision is another symptom associated with hypertension. This condition, known as retinopathy, is caused by damage to the blood vessels in the eyes. It's not a definitive sign of hypertension, but if you're experiencing vision disturbances, it's a good idea to have your blood pressure checked. Chest pain is a more serious symptom of hypertension, and it can be a warning sign of a heart attack. The excessive pressure in your arteries can strain your heart, leading to chest discomfort or pain. This is a serious symptom that requires immediate medical attention. Now, it's crucial to understand that hypertension is often labeled the silent killer because many people with the condition don't experience any symptoms at all. That's why regular checkups and blood pressure screenings are so important, even if you feel perfectly fine. One symptom that's often overlooked is fatigue or confusion. High blood pressure can lead to lower oxygen supply to the brain, which may result in these issues. If you're feeling unusually tired or finding it hard to concentrate, it's worth mentioning to your healthcare provider. Lastly, blood spots in the eyes, facial flushing, and nosebleeds can also be signs of hypertension. Again, these symptoms can be caused by a variety of conditions, not just hypertension, but they're worth discussing with your healthcare professional if they occur frequently. Early detection of these symptoms can prevent serious health complications. So, always stay vigilant and prioritize regular health checkups. Remember, knowledge is power when it comes to managing hypertension. Have you heard of mean arterial pressure, or MAP? It's a term that might sound technical, but it's integral to understanding our blood pressure. MAP is a measure of the average pressure in your arteries during one cardiac cycle. This means it gives us a snapshot of what's happening in our arteries throughout the entire heartbeat cycle, not just at 2 points. Now, why is MAP important? It's considered a better indicator of perfusion to vital organs than systolic blood pressure alone. In simple terms, MAP helps healthcare providers understand whether there's enough blood flow and consequently oxygen reaching your organs and tissues. It's like a traffic report for your bloodstream, giving a clearer picture of how well your cardiovascular system is working to distribute that life-sustaining blood throughout your body. Let's talk numbers. A normal MAP is generally considered to be between 70 and 105 millimeters of mercury. If you're within this range, it indicates effective perfusion of the organs without undue stress on the cardiovascular system. It's like cruising at a comfortable speed on the highway, not too slow, not too fast. But what if your MAP is less than 60 millimeters of mercury? Well, that might be a cause for concern. This could indicate that there might not be enough blood flow to supply oxygen to vital organs, a situation that could lead to conditions like shock. It's like a traffic jam in your bloodstream, and your organs might not be getting the oxygen they need. On the other hand, higher MAP values may indicate too much pressure on the arteries, potentially leading to damage over time. It's like driving too fast on the highway. You might reach your destination quicker, but the risk of accidents and wear and tear on your vehicle increases. It's important to note that the optimal MAP can vary based on individual factors, including existing health conditions. Healthcare providers use MAP, among other indicators, to assess the adequacy of blood flow and overall blood pressure management, especially in critical care settings. MAP is an important measure to assess the adequacy of blood flow and overall blood pressure management. So the next time you check your blood pressure, remember that the number in parenthesis, the MAP, is giving you a comprehensive view of your arterial pressure. Do you know what causes hypertension? Hypertension or high blood pressure is a condition that can sneak up on you without any obvious symptoms. It's like an invisible enemy attacking your body from within. There are several factors that can lead to hypertension, and understanding these can help you take preventive measures. First up, we have stress. In our fast-paced society, stress is a common factor that can lead to hypertension. When you're stressed, your body produces hormones that temporarily increase your blood pressure by causing your heart to beat faster and your blood vessels to narrow. Next, we have smoking. The nicotine in the cigarettes can raise your blood pressure and heart rate, make your blood vessels harden and narrow, and make your blood more likely to clot. Obesity is another significant cause. Carrying extra weight requires more blood to supply oxygen and nutrients to your tissues, which increases the amount of pressure on your artery walls. Certain medications like oral contraceptives or birth control pills can also lead to hypertension. These pills can cause blood vessels to narrow and your body to retain water, which can increase your blood pressure. Then we have stimulant use. Stimulants such as drugs or alcohol can cause your heart to beat faster, leading to increased blood pressure. High sodium consumption, high cholesterol and diabetes are dietary and health factors that can contribute to hypertension. A diet high in salt can cause your body to retain fluid, which increases blood pressure. High cholesterol can lead to atherosclerosis, which narrows the arteries, and diabetes can damage blood vessels, leading to hypertension. A sedentary lifestyle, certain racial demographics like African American men, and old age can also increase the risk of developing hypertension. Regular physical activity helps keep the heart and blood vessels healthy, reducing the risk of hypertension. Understanding these causes can help you take preventive measures. By managing these risk factors, you can maintain a healthy blood pressure and reduce your risk of hypertension. Are you aware of the complications that can arise from hypertension? Hypertension or high blood pressure, if left untreated, can lead to a myriad of health complications, some of which can be life-threatening. Let's begin with the cardiovascular system. Over time, high blood pressure can damage the arteries, leading to a condition called atherosclerosis. This is when the arteries become hardened and narrowed due to the buildup of fatty deposits. Atherosclerosis can limit the flow of blood to vital organs, leading to heart attacks and strokes. Then there's heart failure. Hypertension forces the heart to work harder than normal to pump blood around the body. Over time, this extra strain can cause the heart muscle to thicken and become less effective, resulting in heart failure. Hypertension can also wreak havoc on the kidneys. The increased pressure can damage the blood vessels in the kidneys, impairing their ability to filter toxins from the blood. Over time, this can lead to kidney disease or even kidney failure, requiring dialysis or a kidney transplant. The brain isn't immune to the effects of hypertension either. High blood pressure can lead to a transient ischemic attack, often known as a mini-stroke or a full-blown stroke. Both conditions occur when the blood supply to part of the brain is interrupted or reduced, causing brain cells to die. Moreover, hypertension can cause vision problems. The increased pressure can damage the blood vessels in the eyes, leading to retinopathy, which can result in blurred or impaired vision, or even blindness. Lastly, there's hypertensive crisis, a severe increase in blood pressure that can lead to a stroke. Symptoms can include a severe headache, severe chest pain, blurred vision, and shortness of breath. If you experience a hypertensive crisis, seek immediate medical attention. These complications highlight why it's so important to regularly monitor your blood pressure and manage hypertension if diagnosed. With the right lifestyle changes and medication, you can keep your blood pressure in check and significantly reduce your risk of these complications. It's crucial to manage hypertension to prevent these serious health complications. So what does all this information about blood pressure mean for you? Let's take a moment to recap. Blood pressure is the force exerted by your heart to circulate blood throughout your body. It's expressed as two numbers, the systolic and diastolic pressures, and falls into several categories from normal to hypertensive crisis. Hypertension, or high blood pressure, can have severe consequences if left unmanaged, including damage to your brain, heart, lungs, and kidneys. Another crucial component is the mean arterial pressure, or MAP, which provides a snapshot of the average pressure in your arteries during a cardiac cycle. A normal MAP value indicates effective perfusion without undue stress on your cardiovascular system. Hypertension can be triggered by several factors, including stress, obesity, and a sedentary lifestyle, leading to potential complications like atherosclerosis. Remember, understanding your blood pressure numbers is a vital step towards maintaining your heart health. To maintain a healthy heart, maintain a healthy diet. Eat plenty of fruits and vegetables. They are high in vitamins, minerals, fiber, and antioxidants, which can help lower blood pressure and improve heart health. Choose whole grains. Whole grains are good sources of fiber and other nutrients that play a role in regulating blood pressure and heart health. Limit saturated and trans fats. Reducing the intake of foods high in saturated and trans fats can help lower your cholesterol levels and reduce the risk of coronary artery disease. Incorporate healthy fats. Sources of healthy fats include olive oil, avocados, nuts, and fish. Omega-3 fatty acids found in fish like salmon and trout are especially beneficial for your heart. Limit salt intake. High sodium intake can increase blood pressure. Aim to limit your salt intake by choosing low sodium products and avoiding adding salt to foods. 2. Regular physical activity. Engage in at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous aerobic exercise each week, as recommended by health authorities. Activities can include walking, jogging, cycling, swimming, or any other exercise that increases the heart rate. 3. Maintain a healthy weight. Being overweight or obese increases the risk of high blood pressure, heart disease, and other health problems. Losing weight can help lower blood pressure and improve heart health. 4. Quit smoking. Smoking is a major risk factor for cardiovascular disease. Quitting smoking can improve your heart health significantly, regardless of how long you have been smoking. 5. Limit alcohol intake. Excessive alcohol consumption can raise blood pressure. Limiting alcohol to moderate levels, up to 1 drink a day for women and up to 2 drinks a day for men, can help keep your heart healthy. 6. Manage stress. Chronic stress may contribute to high blood pressure and other heart health risks. Techniques such as meditation, deep breathing exercises, and mindfulness can help manage stress. 7. Regular health screenings. Regular checkups with a healthcare provider can help detect and manage risk factors like high blood pressure, high cholesterol, and diabetes early on. 8. Get enough sleep. Lack of sleep can increase the risk of high blood pressure, obesity, and heart disease. Aim for 7-9 hours of good quality sleep per night. Implementing these strategies into your daily life requires commitment, but can have a significant positive impact on your heart health and overall well-being. It's also important to work with healthcare professionals to develop a personalized plan that suits your specific health needs and goals. Please subscribe and share to help keep the Heart Healthy movement. Thanks.